Welcome to Azad Bioacademy. Today I will talk about some effects of heart or intrinsic activity of heart that would be like neurological effect of heart on heart or some cardiac activity. So precisely if I just give a terminology, that is neurocardiovascular effects, that would be my today's lecture topic. Okay, so before going to detail, if I just give you an introductory matter, that is inotropic effect. You have heard the word inotropic effect, chronotropic effect, bathmotropic effect, or dromotropic effect, like that. So that would be my today's lecture. Okay, so firstly I will just try to explain one after another. First one is inotropic effect. Inotropic effect. Okay, so just if you look into it, that is inotropic. The word comes from the Greek two word. First one is inos, and second one is that is trypin. Okay, so inos means the fiber or muscle, the Greek word, and trypins means to turn, or you can say to change the direction, to change direction. Okay, so overall, what would be the exact meaning of inotropic effect? So the fiber or muscle change. So heart muscle change, basically, the functioning way, it will contract and relax. Okay, so here the in force of contraction or in force of changes of the cardiac muscle is called inotropic effect. So cardiac muscle contractile activity is called inotropic effect. Okay, so inos means muscle, and the tropic comes from the change. Okay, so overall, in force of contraction of cardiac muscle. Okay, so this is inotropic effect. So already, if I just give you an examples, if you are taking some agent or within your body some agents are there, so if that work on the heart and if the contractile activity is increased, so that would be one terminology. And if it just change in the negative toward the negative way, that is, it will decrease the cardiac contraction, so the terminology will be different. So just what I wanted to say, that is, the inotropic effects is two types. One is positive inotropic effect. Another one is negative inotropic effect. Okay, so I say this is positive inotropic effect, negative inotropic effect. So which agents or which substances increase the cardiac muscle contraction? That can be said positive inotropic agent or positive inotropes, or which will just decrease the cardiac muscle contraction, that would be the negative inotropic agent or negative inotropes. Okay, and if we just give some example, that would be, you can say, noradrenaline, adrenaline, or here you can say beta blocker. So example, you can say atenolol, metoprolol, bisoprolol, propranolol. That means cardioselective or non-selective. Basically, the beta 1 receptor is very much rich in heart, so that will when it will be inhibited, then overall cardiac muscle contraction, the signaling pathway will be inhibited. And you can say calcium channel blocker. So here I will say cardioselective calcium channel blocker, basically verapamil, diltiazem, like that. That can decrease the cardiac muscle contraction. Okay, so inotropic effect is cardiac muscle contractile effect, and that is positive or negative. Positive inotropic agent that will increase the cardiac muscle contraction. Negative, it will decrease the cardiac muscle contraction. And the muscle contraction, basically, the heart is ventricular contraction is very much important. Both are important, but ventricular muscle contraction will supply the blood to the systemic circulation, as well as it will send the blood to the lungs. Okay, so primarily the inotropic effect is just happening within ventricle, but also it's the matter of atrium. Okay, so first one is your inotropic effect. Now I will come to the second point, that is chronotropic effect. Chronotropic effect. Chronotropic effect. So here, chronos, the Greek word chronos, and it means time. Okay, and tropic already I discussed, so I will not repeat it. That is to change or to turn the direction. So time. So when something will change with time, so you can easily put the word that is rate. Okay. So what will change regarding your cardiac muscle? That means when your heart muscle activity will change according to the time, so that would be the rate. So cardiac muscle, so you can say this is heart rate. Okay, so with the course of time, the heart muscle change, that is called heart rate. So the beat. Okay, so here you can also think in two ways, that is positive chronotropic effect, and you can say negative chronotropic effect. That means some agents can increase the heart rate, that is positive chronotropic agent, and some agents can decrease the heart rate. So if some cardiac heart rate just increasing above the normal range, that is tachycardia, and below the normal range, that is bradycardia. Okay, and if I just try to give you some example, then you can just think the previous example, that is very much correlated, because when the heart muscle will contract, then it will relax. That means your heart rate. Okay, so here contraction is also necessary. So the example would be the same. That means noradrenaline, adrenaline, you can say dobutamine, and here you can say beta blocker, you can say calcium channel blocker. Okay, the example is same. And chronotropic effects. So what will be the primary basic site of the heart? That is, heart rate, which is increased. Basically, this is SA node. Okay, SA node activity will increase, then overall cardiac activity will increase. Why and how? This is the matter of some agents that will instigate the SA node, and also SA node itself has capable to produce action potential. So this is an overall, chronotropic effects. So SA node would not be itself be enough to just change the whole beat of the heart. So that's not possible. So overall, it's a combination effect, but primarily I just try to say primary consideration. Okay. So this is the chronotropic effect. Third one, that is dromotropic effect. Dromotropic effect. So dromo, this word also comes from dromos, okay? Also Greek word. And dromos means, what does it means? Dromos means the path, that is way, or you can say course. That means if I want to go somewhere, that I must follow a way. That means something to travel or something to just move according to a way or path. That would be the drama. And tropic, the change. So what would be the way of something regarding heart? That is, SA node will generate your action potential, then it will go to the AV node, then bundle of His, then Purkinje fiber, like that. So this is the way, and it will travel. Who will travel? That is the potential changes. That is your cardiac impulse. So what would be the terminology there? Their terminology would be how it will travel. That is the conduction velocity. Conduction velocity. Okay. That means how quickly the action potential will travel. That is the dromotropic effect. Okay, so basically, you already I said SA node is one of the crucial pacemaker, but here, but overall the dimension change from the AB node. So primarily, because of AB node activities, dromotropic activity can dramatically change, but overall the whole system is responsible. But primarily, you can consider AB node. Okay, but before the previous two terminology, here also the positive dromotropic effect and negative dromotropic effect. So what would be the example? So if cardiac muscle contraction occur, and if it is just occurring according to the time and a velocity is connected there, so overall it will produce a beat, and it will the beat per minute, and then it will heart rate like that. So I'm trying to connect you with the previous two terminology. That means the example would be the same as before. Fourth one, bathmotropic effect. Bathmotropic effect. Okay, so what does it mean, bathmotropic? So bathmos comes from the Greek word. Bathmos means threshold, or you can say this is the stave. So what does it mean, threshold? Threshold point is the point from which something can change the direction exactly, or where something exactly initiates. That is the threshold level or threshold point. Okay, so cardiac muscle, SA node can generate action potential by its own. That means by automaticity. That is the issues. But cardiac muscle also give response to the external factors or your body factors. Suppose you are afraid or you are going for exercise, so heart should be more quicker. That means heart rate will be increased to give blood supply more throughout the body. So of course, heart muscle has also a threshold point. That means excitability. Okay, if something just change the threshold point or decrease the threshold point, that means quickly it will activate to generate the action potential or travel the action potential. Okay, and if something just make it delay, so that would be the different things. That means your bathmotropic effect is basically the excitability excitability of the heart muscle, heart excitability. That means excitement. Okay, heart muscle excitement. So excitement depends on the threshold point. This effect is also two types, positive and negative. Okay, so positive and negative. So what would be the example? You can say low dose of digoxin is one of the good example which will just decrease your threshold level. That means it will easily excite the heart. Okay, and what would be the example? That would be the potassium. Okay, if potassium level high, then it will just decrease the cardiac muscle excitability. Okay, so this is the BATHMOTROPIC effect. So DROMOTROPIC effect, BATHMOTROPIC effect already I covered. So now, oh sorry, here this effect is basically excitement, and excitement is connected with basically SNR and also all other functional tissues. Next one is here lusitropic effect. Lusitropic effect. So this word comes from lucis. Okay, and lucis means relaxation. Relaxation. So heart muscle will relax. Okay, so while heart muscle will relax, so you can say the lusitropic effect. So as before is also two types, positive lusitropic effect and negative lusitropic effect. That means some agents will just make your heart relax and some agents can decrease it. So you can say the example of lusitropic effect is levosimendan. Okay, on the drug, and negative effect is high dose of digoxin. Okay, another different example are there. So this is the lusitropic effect. So if you just try to think about the terminology lusitropic, relax, so what would be the primary location of the heart? That is ventricle. Okay, of course other atrial part is also there, but primary you can say ventricle relaxation. So this is the lusitropic effect. And for your kind information, another terminology you can consider, but I will not explain it because it's very silly one. That is ionotropic effect. So iono means ions, different types of ions. So effects of different types of ion on your heart or contribution of ions within your heart. So that is the inotropic effect. So you can consider potassium, you can consider sodium potassium ATPs, or you can consider other ionic channels or ions. Okay, so this is ionotropic effect. That is also positive, negative ionotropic effect. Okay, so if just I would like to sum up the lecture, that is chronotropic effect. That means the heart rate related matter. Ionotropic effects means your heart contractile muscle, heart muscle contractile matter. And if you think about the dromotropic effect, that means the velocity of the conduction of impulse, and bathmotropic effects, that excitement of the heart muscle, and lusitropic effect, that means relaxation of your heart muscle. Okay, and all the effects can be positive or negative. Those substances which can contribute for positive way, that means the positive trophic effects, positive trophic agent or trophs, or just opposite is negative agents, that is negative inotropic effect or negative inotropic agent, like that.